So dual use of AI as well as this high-tech DME is definitely assisting with clinical outcomes and insight. Making recommendations for this has shown a lot of success among some of my residents. And so I'm going to present a few case studies for you guys. So this is some of the sample data that I gathered from my residents that do, in fact, use Accora beds. And so this is case study one. This, as you can see, this resident moved in July. You don't see any detections up until about the point of July. This resident has Parkinson's. Parkinson's, as you all are aware, is a very challenging neurodegenerative process, especially, with motor skills moving forward. Sometimes it's very unpredictable behaviors and impulsivity as well. As you can see, the Accora bed implementation occurred right at the end of August. They were really struggling with a lot of falls, a lot of impulsivity in August. And around August 21st is when the Accora bed was implemented here. So with both using Safely You to detect the falls and gain some of my clinical insight, and then the Accora bed implementation, you can see a really drastic reduction in the volume of falls that this resident was experiencing. So you can see September, October, November, and these events have been, very non-injurious and just overall decrease in volume of falls. So this is definitely a special case here. So case study two, this resident has a lot of highs and lows. There's a lot of behaviors with this resident here. Newly moved in. This resident had a few falls and then kind of tapered off in the early part of the year. And then we're getting into January. In January, this resident was having some kind of infection, not COVID, but definitely having some kind of illness, just a lot of falls, big increase in the falls there. Accora bed was implemented in late February, and we see a drastic stop, just a big, massive 5-month stop of falls here. And then just for reference, the falls that have occurred over the summer months and the early part of fall, these were not occurring near the bed. They were not occurring. They were just mostly happening with, some self-transfer with wheelchairs and whatnot. But definitely the bed falls that were occurring in the early part of the year had a very abrupt stop after the Accora bed was implemented here. And so you can see the 5-month gap, which is great. Again, less injury and less volume is the big goal here. So we'll ignore the first two bars here. This resident had a really, really good run up until about May. Late May, resident was falling a lot, having a lot of behavior issues. And in June, the resident was sent to the ER a couple times, and then also in July and August a few times. Mid-August, Accora bed was implemented. We also did many other interventions, things with night lights. With my consultation, we got the resident some eye exams, definitely got the resident new glasses. It turns out she hadn't had new glasses in about 15 years. New glasses, nightlight implementation, as well as the Accora bed. And you can see she's not had a fall or an ER send out since then.